concept is to restore some hearing sensations to totally deaf patients. Now, to explain how this works, I'd like to show you this model of the ear. Now, you may remember that when we hear sounds, the sounds are picked up and travel through the ear canal down to the eardrum. Here they vibrate the eardrum, moving the little ear bones, and eventually these little ear bones vibrate the fluid of the inner ear. And it's the inner ear that we're talking about today, and here it is, the so-called cochlea. The nerve fibers are splayed out rather like the keyboard of a piano. Here little hairs vibrate to the sound, stimulating the nerve endings. The sound is then transmitted down the nerve to the brain. In patients with total hearing loss, it is these little hairs that are missing inside the inner ear. The nerve fibers, to some extent, survive. The concept behind the cochlear implant is to place an electrode inside the shell of the inner ear so that it can stimulate the remaining nerve fibers direct, bypassing the faulty hairs. The implant device is manufactured in Sydney by Cochlear, a subsidiary of Nucleus Limited, and it is exported now throughout the world. Here you can see there are 22 tiny electrodes which are connected by wires which pass into the body of the device. This device is implanted under the scalp with the tail passing down through the bone behind the ear and into the inner ear. Here's the device implanted beneath the skin with its tail passing down inside the inner ear. Outside, the patient wears something that looks rather like a Sony Walkman. The body of the device is a speech processor, and this picks up sound signals from a microphone and extracts the most important features of speech. These are passed up a cable to a transmitting coil worn just behind the ear. The transmitting coil transmits those features to the cochlear implant, which then in turn passes the message down to the electrode to stimulate the nerve.
David became totally deaf from meningitis when he was 2.5. He stopped talking within a year of losing his hearing and did not start again until he was in school. Without hearing, his speech became unintelligible, and he had to acquire language through vision.
There was a hidden part. Hidden part. Hidden. It was hiding. You couldn't see it. A hidden part. Hidden. Hidden. I'll spell it for you. H-I-D-D-E-N. Hidden. Right. There was a hidden part under the leather back. Under the leather back.
These are the operating rooms of the Royal Prince Alfred Hospital, and David is being prepared for his operation. The site of the skin incision behind the ear has been marked, and the surgery can begin. The operation can take as long as 3 to 4 hours, so careful anaesthesia and monitoring is necessary. The skull behind the ear is drilled to allow the insertion of the cochlear implant. First, the opening is made through the mastoid bone. Next, the microscope has to be brought in to do the delicate work of opening up the inner part of the ear. Here you can see the round window being revealed. Next, the skull is prepared for the implant itself, and a circular hole is made to receive the body of the implant device. This is the implant, the 22-channel device, and here it is being inserted very carefully into the inner ear. Great care is taken so as not to damage the structures of the inner ear itself. Next, the body of the implant is firmly placed into the opening in the skull so that it is held solidly in position for all the patient's life. Ties around the tail of the implant prevent the lead from moving around.
Good. Tell me where you first hear it. Okay. Learning to use the implant will be a very gradual process for David. He'll need practice in discriminating sounds, words and sentences, as well as in using the implant for communication purposes.
Hard.
Hard.
Hod.
Hard.
Heard.
Heard.
Heed. Heed.
Heard.
Hooed. Hooed.
Heard.
Okay. The first one is lip reading with the speech processor. Is it turned on? Okay. Apa.
Papa.
All right. It was P. Apa. Okay. Ava.
Papa.
Ana.
Mama.
Good. Asa.
Look out, he shouted,
What out is sad,
but it was too late.
but it was so out.
The man in black swung the axe down.
Papa, Papa, spa, but out down.
It just missed the professor's head
Is that this the Papa's head?
and smashed into the ground by his feet.
As bad as you the crown, but it's bad.
Jack pushed the professor to one side
That was the Papa that you found sad.
and grabbed for the man in black.
Out Bob's, Papa, on the back.
The benefit David derives from the implant can best be seen in his everyday life. He's now able to follow what people are saying more easily and can participate in a normal school situation.
The cochlear implant offers a new hope for totally or profoundly deaf children who until now were unable to hear sufficiently, even using the most powerful hearing aid to be able to develop speech communication. Usually these children had to rely on signs. The capacity to learn speech is best within the first 6 years of life. After the age of 12, it is almost entirely lost. Thus, a person going to a foreign country has to learn to speak the new language using the sounds they learnt before they reached 12 years of age. A Frenchman coming to Australia has to use French sounds to speak Australian, hence he has a French accent. Now David has a similar problem. He has to use the sounds he learnt whilst he was deaf to speak. He has a deaf accent, and it will take many years for him to overcome this. However, David has already shown a remarkable increase in his ability to be able to understand speech and to communicate. The hope, however, is for the very young children who still have the ability to learn new speech sounds. They have so much to gain. Until now, such children have been taught by a mixture of visual signs plus the sounds they can hear through their hearing aids. Often these sounds are not particularly good or helpful. So the children rely more and more on the signs to understand. And unfortunately, many of these children become totally dependent on signs for communication. Let's hope the cochlear implant can break down these barriers, can make it possible for the deaf to speak to the hearing, so that both the deaf and the hearing can enjoy life together.